Good afternoon or good morning, depending on where you're joining us from. Today's webinar is a panel discussion focused on leveraging your digital assets to improve the quality of life for your residents. And I'm pleased to welcome back Nick Patel, President of ThriveWell Tech, as your moderator. Nick is the President of ThriveWell Tech, a consulting arm of Asbury Communities, Inc. Nick has more than 15 years of experience in strategic planning, finance, operations, and sales management in both domestic and international markets, including with Fortune 500 companies. Nick is responsible for business growth as well as the strategic planning and execution of technology hardware and software initiatives and programs. Nick received his bachelor's degree in management from England's University of Manchester School of Business, and he is a certified public accountant. Thank you, and over to you, Nick.
Thank you, Gary. I'm going to project the screen, so just give me a second. Hopefully you can all see my screen now. So today's session, to recap, it's leveraging your data assets to improve quality of life for your residents. This is very much of a follow-up or adding to the topic we discussed on Monday. I don't know if any of the audience was able to attend that session, but we uncovered really how much technology and data is going to play a major role in senior living. Today, I'm privileged to have a very insightful panel, knowledgeable panel. We're hoping to have a very meaty discussion. We'll start with introductions. And then we're planning to leave around 20 to 30 minutes at the end for discussion around questions that come from the audience. So I'll do a quick intro, and then I'm going to hand off to the team on the panel to do a more detailed introduction. Myself, I'm President of ThriveWell Tech. I'm going to cover our service offering. And on the panel today, we have AJ Peterson, VP and General Manager, Care Guidance from NetSmart. We also have Travis Palmquist, VP and General Manager from Point Click Care. And we have Fahad Aziz, CTO and co-founder from CareMerge. These are all industry-leading platforms. I would consider them thought leaders in senior living. And we'll be hearing more from each of the providers here. I'm going to cover the objectives. Today, what we're going to cover broadly is how data will shape the industry going forward, and examples how it's impacted resident health outcomes and bottom line. How interoperability will help with referrals and improve clinical outcomes, and strengthening the continuum of care with software and tech, leading vendors' approach to breaking down post-acute silos. So very heavy on technology and data from the perspective of our panelists today. Going into introductions, ThriveWell Tech. So we relaunched a 20-year-old company on March 1st. We are an MSP, so and I lead the group. We service and provide for all the technology needs for senior living customers across the country. We've also expanded into adjacent industries. We have in the team an end-to-end strategic view. We support our strategies and recommendations through execution. And we really act as the outsourced IT arm of any senior living organization, from small to large. Our key differentiators, I think you'll come to learn through the discussion today. We definitely have a very much entrenched DNA in senior living, so we understand the industry from its core. We're heavily data-driven, so we're now reinventing how data is viewed and how we glue all pieces of data together. We have a very strong EMR enablement team, including training. So we often work closely with each of the providers on the panel today. And really what we provide is a very robust roster of expertise from engineering, application support, virtual CIO, security, field support. So your organization doesn't have to. So we basically partner up and allow you to access these resources. First, on our panel today, we have NetSmart. And I'm going to hand over to AJ Peterson to do a more detailed introduction to himself and NetSmart.
Great, thank you, Nick, and great to be with all of you here today. My name is AJ Peterson. I am the Vice President and General Manager of our Care Guidance Solutions here at NetSmart. I've been with NetSmart for a little over 10 years and really started 10 years ago in developing and optimizing our interoperability platform, and then have extended a suite of solutions to the broader care continuum. Our company, we're a 53-year-old healthcare IT company, one of the longest standing companies in the health IT companies in the country. We're located in Overland Park, Kansas, have offices across the country, and are operating in all 50 states. We're really a kind of a leading technology provider focusing in on community-based care, and we define that by different market segments of senior living, care at home, and then getting into behavioral health and social service organizations as well. We provide enterprise electronic health records systems that support the full care continuum, but then we also have a full suite of platform solutions, which we call our Care Fabric platform, that really extend the core EHR systems to help providers and organizations thrive in the new value-based care world. Supporting full IT outsourcing, cloud hosting, revenue cycle management, and then getting into some of the workforce management, route optimization. And then our care guidance suite of solutions is really built around some of the topics that we're going to be talking about today, around interoperability, data sharing, getting into virtual care, family resident engagement, and data analytics. And then all of this sits on top of a population health management tool that we provide directly to payers, as well as provider and state organizations that are managing an overall population. So I'm very excited to be on the panel with my colleagues today, and kick it back to you, Nick.
Thank you, AJ. I'm going to hand over to Travis to do a quick introduction about his role in point-click care. It's over to you, Travis.
Thanks, Nick, and equally as excited to be here with you all today. Yeah, a little bit about me quickly, I guess. 25+ year veteran. Can't believe I'm using a number like 25 already, but first part of my career was spent on the operations side. Had the good fortune of really running skilled nursing facilities and assisted living communities. Brought that into the tech world in the early 2000s and have been in that space ever since. So hopefully a little bit of perspective from the real world, and being able to translate that into really what this whole technology transformation means to operators. When as far as just giving you a little bit of background on point-click care, our goal, our mission, we help long-term post-acute care providers really operate and gain the confidence they need to navigate the new realities of value-based healthcare. And even our description is evolving as things are rapidly changing in the marketplace, and what operators really need to thrive in this quote unquote new normal become very, very obvious. We want to help our customers achieve preferred status in a very competitive and shrinking network environment. Optimizing financial and operational health has always been important, always will be. Attracting and retaining the right staff, connecting to the right partners, and more importance, obvious, is the insights needed to effectively manage and mitigate risk. We have been recognized by Forbes as one of the top 100 private cloud companies. We've been acknowledged by Class Research as best-in-class vendor for long-term care. We really lead the way in creating cloud-based environments where providers, patients, and payers eliminate data silos between care settings. We help connect stakeholders to meaningful insights. We have a suite of fully integrated applications powered by an interoperable, mobile-friendly, and regulatory compliant electronic healthcare record and revenue cycle management platform. Just to wrap it all up, Point Click Care helps care providers connect and collaborate with their care network. We have over 21,000 skilled nursing facilities, senior living communities, and home health agencies that use Point Click Care today, really making us the North American healthcare IT market leader for LTPAC industry. And again, appreciate the opportunity to be here today, Nick.
Thank you, Travis. And last but not least, we have Fahad, CTO and founder of CareMerge. I'll hand over to Fahad for a quick introduction.
Hello, everyone. Thank you, Nick and team, for having me on this webinar. My name is Fahad Aziz. I am a co-founder and chief technology officer of CareMerge. I'm also a contributor to Forbes magazine, where I cover technologies that are reshaping and reinventing senior living experiences. CareMerge, we provide a EHR, a clinical system, and an engagement system to senior living communities. We believe that by combining the two, there's an opportunity for operators to promote wellness and inspire collaboration. My background is in technology, and I had a unique opportunity 9 years back to spend a couple of weeks in a assisted living community, suburbs of Chicago. And while I was there, I saw some of the challenges that the staff were facing, and especially with the communication with the families or with their EHR and their assessments and tracking. So that was the birth of CareMerge, launched in 2012. Today, we are proudly serving over 500 communities in US and in Canada. We have been backed by some of the leading investors, including Insight Venture Partners, Ziegler Linkage Fund, and Echo Ventures. We were named in 2018 and again in 2020 by Inc. 5000 and one of the fastest growing companies in US. So very excited to be here and have the opportunity to share my thoughts and experiences.
Thank you, Fahad. So as you can see, very, very knowledgeable panel, and quite well represented in terms of the industry when it pertains to EMR and wellness and data overall. So we're privileged to have this panel. I'll lead the discussion, and it's really going to be an interactive panel discussion. Hopefully we'll uncover a lot of good topics, but we look at the industry today. We're at the cusp of something that's very exciting, but also we're living through unprecedented times. What we've seen over the past 12 months is there's been a heightened awareness of how data and technology can lead the industry to new levels of maturity. We've seen the population we serve, it's the most at risk, and yet it's an industry that's trying to solve very tough challenges whilst navigating occupancy issues. We are seeing more adoption of telehealth, remote patient monitoring, so that's very exciting. I can tell you personally, I've started visiting my doctor through telehealth. That wasn't the case 2 years ago. It wasn't a common approach. We're also seeing a movement towards aging in place, and now technology is available in the home, and there's a lot of connectivity back to the families. There's less urgency at a macro level for folks to want to move to senior living. So these are the challenges. We've put the panel today to really talk about how do we digitize some of the industry, look at the telehealth and RPM adoption rates and see how that's forming new records for us, and really look at beyond aging in place, the care settings that we serve that have less data available or collected. And we are seeing a movement towards data being valuable in those care settings. And we're going to talk through that today. So hopefully you'll enjoy the session. We're going to leave plenty of time for questions at the end. So I'm moving to the panel discussion. We'll start off kind of addressing the first agenda here, how data will shape the industry going forward, and examples how it's impacted resident health outcomes and bottom line. So obviously, we have to be quite astute in being financially responsible, but we are seeing data, it's going to solve some of our issues. So I'll start the panel discussion, and we're going to do a round robin, so I'll keep our panelists on their toes. we're seeing data use cases changing. The question here is, over the past 12 months, we've changed the way in which data is viewed and how we see it coming in and needed and used in EMRs. So how does that correlate back to the bottom line in your view as we see the industry suffering? So maybe I'll start with Travis for that one from Point Click Care.
Great, thanks, Nick. Yeah, I mean, you know, if you look at just how much things are changing, how rapidly they're changing, and some of the dynamics driving that, you know, we have an aging population, somewhere around 52 million, 65 and older in 2018. The demographics tell us we're going to be at 95 million by 2060. At the same time, we are seeing a workforce that, whether it's shrinking or not, I'm not sure, but it's certainly challenging for providers and adds a lot of difficulty to get enough staff to do the job. And then at the same time, we've got this massive influencer that's happening in this shift to value-based care. Medicare and Medicaid are no longer just writing out blank checks. So this need to pull data and make it visible to all the stakeholders in you know, true integrated care coordination fashion is becoming more and more evident. In order to thrive in this quote unquote new normal, the data, I think you've heard it probably overused by this point, but the whole term that data is the new donuts, it's really the currency to participate and be a good partner. And it's a major shift. And you know, I was operating, you know, almost 20 years ago now. You know, we did. It was important for us to get data. We had no way to electronically or efficiently share it. The opportunities today to really step forward, provide that transparency, separate yourself in the marketplace, be more competitive, be a better partner, drive better outcomes. They're there, and people and operators need to have an active plan to participate and get in that space, and it's going to have a big impact on the way their operations are run and their success they're having.
And absolutely, I think that's a good overview. AJ, any thoughts around that topic?
Sure, yeah, to kind of follow up there. So like over the last 12 months, I mean, we saw kind of a complete shakeup of the healthcare system, and looking at how really care was scattered over the pandemic, and providers were really struggling and scrambling to access relevant clinical data on a new person that they may have never seen before. So the use of interoperability and tools were really accelerated by necessity. It became a kind of a shift through the paradigm of, you know, we have this solution, and now we have to really start using it. And, you know, to really looking at it from the ability to share data kind of seamlessly across care settings. When you look at from acute care to primary care to senior living, even down into care at home, was really important. So, and really the leap has been around not only being able to transport the data, but having it be available in real time, having it be real comprehensive, but then also for providers to be able to consume that discreetly into their systems and present that information in a meaningful way into their natural workflows. So, and Travis touched on it, as well as being able to have the ability to report data back out. So, you know, whether we're a senior living community and, you know, a resident has to be sent to the hospital, allowing that hospital to have access to the care that's being received in the senior living community. And then when they come back, being able to have that data from the hospital stay and have it automated. So where the system is fetching that data and then putting it discreetly into a workflow of a provider. So I think that, you know, over the past few years, we as an industry have been doing a good job of really kind of laying the pipes from an interoperability perspective. And I think over the past 12 months, it was really around, you know, how are we, you know, filtering the water or getting the data that is necessary in contextually relevant ways to support very specific workflows across the broader healthcare ecosystem. So from a interoperability technologist, it was, you know, the pandemic created a great opportunity to accelerate some of these strategies that have been working over the past years.
Thank you, AJ. Yeah, definitely we've seen that data coming from different care settings. And I know, Fahad, you have a broader view with wellness. So what's your take on how data's been kind of the new use case over the last 12 months?
Yeah, absolutely. I agree with what AJ was saying. We did a lot of work in the past few years, and we saw some of the outcomes of those work in last 12 months. When we had an opportunity we work very closely with assisted living, memory care, CCRCs, and we see a big shift in last 12 months and next 12 months for the data usage. In last 12 months, as the focus with the lockdown and the pandemic, the focus was more on the safety. And we saw the use of data to meet that requirement. We saw a lot of reporting requirement from state, from operator, even from the feds. So that was the need of the data. They were trying to come together and figuring out what do they have in their communities, what type of residents, what they need to do to support them, to keep them safe. In next 12 months, we are starting to see a shift where operators are looking at, okay, so the safety vaccination is out there. The safety is a concern, but not as a big concern as it was. Let's now talk about profitability. We have spent a lot in the last 12 months. Let's talk about census. How can we use the data coming from the EHR, from their CRM systems, coming from their billing systems, and how they can help every community part of their portfolio to increase their census and increase their profitability. So we're seeing some very interesting use cases of data in now and in next 12 months.
Yeah, that's a great topic, and we've got more a deeper dive on that specifically. As we gather data from all levels of care, now there's a need to even look at levels of care that typically there was very sparse data. I'll go back to Fahad in reverse. Do you see there's an ROI for gathering data from, and I'll be kind of more specific around the populations in CCRC world, the independent living population, in the general industry, HUD housing or senior housing, where there hasn't been historically a need to gather data. And what are your thoughts around the need for it, and is an ROI now that's forming that makes it relevant?
Absolutely. So as I mentioned before, the one aspect of it is the census and how to make sure that you have prospects, you know how to engage with them earlier in their journey of making a decision, and to make sure that your beds are filled up. That's one aspect, and data can help you there. But once you have the residents in the communities, you are basically you have to provide them better wellness, better care. You have to prove them that being here is a better value for them than being at home, right? You are in competition with all these technologies that are available to them at home. Maybe there are delivery services, there are home healthcare, telemedicine, ability to get food delivered. Now, if you offer the same services in your community, that doesn't create a unique differentiation. So now the communities are thinking, okay, so if they are in our communities, we want to make them live independent. We want to make them live happier and longer. So how do we track their activities, their wellness, and join them with the data of their clinical, their transitions, and create some meaningful analysis that can help us provide them better care. So we are seeing a lot of discussion, a lot of initiatives in this space.
No, absolutely. We see the same. And I think there's a broadening or merging of various care settings, including at home. Same question to AJ. As we're gathering information, do you see from NetSmart's view a need or an ROI to gather data from care settings that typically didn't have a lot of data collection?
Yeah, I agree. I think that, first of all, there's a real benefit to having a single kind of full continuum platform so that you ensure that data is flowing seamlessly between care settings. So as a kind of a resident is transitioning from different care settings, their clinical and financial information goes along with them, which is really important. So you're supporting, skill to assisted living, independent living, and memory care is really helpful to get to your kind of your data question. But then also to what Fahad was saying, as far as looking at, additional services that could be provided, looking at health clinics that are on site at senior living communities to really drive and ensure a more kind of proactive or preventative actions, and even looking at assigning case managers to ensure that individuals are kind of meeting needs and goals that they're setting forth. And I think from what Fahad said as well, agree, offering lifestyle changes as well as wellness courses, and even to helping get medications filled, are all different services that could be added on, which I think is really important. Also looking at it as a way to boost additional revenue. So when you look at more of the higher margin revenues at an organization into the on the independent living side. So really, I think it's a lot around helping individuals get preventative care as a service, and that also helps to drive up census, and as well as continually kind of growing your population inside of your communities, offering some of these wellness, preventative care, social service support services that will then help drive kind of the high margin business with inside of an operator's facility through a CCRC.
Yeah, absolutely. I mean, I think we know, at least financially, and from the mission to keep our residents safe and well, the longer they're in independent settings, the better. So I think there is a use case. Travis, anything to round off on that question from your perspective?
Yeah, and obviously, Fred, AJ had a lot of, I won't repeat a lot of what they covered. I'll try to add something a little bit new to the whole ROI type thought. Again, I'm going to go back to the point that the government is no longer writing blank checks for Medicare and Medicaid. Now, I also realize, obviously, that senior living is still primarily a private pay market. And if we think a little bit about what's going on with ACOs and value-based care, I think often senior living feels like they're on the outside looking in, and this really doesn't have a meaningful impact on our day-to-day operation. I would just suggest kind of going down this thought process. If you think of what the challenges are, whether it be for the acute payer or whether it be for the acute care provider, whether it be a reduction of readmissions, whether it be the continued aggressive amping up of quality targets, but at the same time they're expected to ramp up quality delivered and do it in a more cost-effective manner. LTPAC has an incredible opportunity to step in there and be a big part of that discussion, and that includes senior living. Payers spend millions of dollars every year just trying to gain simple insights into what's going on with their high-risk population. A lot of their high-risk population may be paying privately, but they're absolutely in senior living providers' communities. And what do senior living providers, what are they best in the world at? What do? They are now actively, as brought up by my fellow panelists, they're doing preventative health and wellness checks. They're managing medication compliance. They're managing chronic disease. They actually have a chart that has information in it electronically that they could be sharing with payers and ACOs and value-based risk bearers. There is a role for senior living to play in this. Why we have chosen not to monetize that in any way, shape, or form to date, I'm not sure, but I think that's a huge opportunity, and technology is going to enable that. These integrated care coordination platforms, yes, it's important to have SNF and senior living and at-home services and all that stuff coordinated and on one platform. What's increasingly more important is to have a total integrated care platform that also provides transparency to the payer and the acute provider, bringing that whole network together. And that's where we're going to drive improved quality. That's where we're going to do it in a more cost-effective manner. And I think LTPAC has a bigger opportunity to take a bigger piece of that and be very active in providing a lot of value to that scenario. From an ROI perspective, being a quality partner, providing transparency, absolutely, as Fahad and AJ said, it's going to have a positive impact on occupancy. Whether you go down the path of formally engaging in contractual risk sharing or not, there's a conversation to be had. There's a seat at that table to be had that people should be participating in, and absolutely should find ways to, one way or another, monetize the value they're offering the full continuum.
Excellent. Yeah, no, I do see a lot of the relevant topics being brought to the surface. So last part on this agenda, I'm going to do a two-part question. We see there's a need, and it's been during COVID, we saw a lot more data being gathered through remote patient monitoring, telehealth, video visits, a lot of digital data points over the networks. If you look at that arena or new data that's being used, how do you see it being relevant in the care settings that we have? Or basically, how relevant is the data we're now starting to gather to the overall story? And then second part is, do we see that trend drifting into aging in place where we typically don't poke around per se, meaning that population is invisible to LTPAC, maybe to the PACE centers and some different care settings, but generally not. So AJ, I'll start with you, and I'll kind of reiterate if the question's kind of complex.
Sure. No, I'll give it a stab here. So, I think about what we've been talking about. It's really surrounding the person with the right level of care, and that being able to do that well ultimately drives the value both to the individual person, but then also to the other stakeholders in the equation, whether it's the health systems or it's with the payers. Investing in remote patient monitoring and telehealth technology, I think, is a real driver of that care to be more efficient and to be more proactive. And, looking at it, how it would reduce the overall cost to keeping someone in the lowest acuity level possible. These tools have really been adopted to both at a commercial grade devices that are deployed out either in the specific care setting or even into the home on the independent living side. But then also some of the non-commercial consumer grade devices of being able to track activities and run wellness programs. I think the market is starting to adopt. I don't think they've gotten to scale yet to where we see kind of wide use of these tools. I think there's a lot of area of growth of adoption to reduce the this burnout from a provider perspective, but then also the efficiencies that are gained when providers can be able to take those kind of passive readings and feed that into their care models in order to ensure that we're maintaining the right level of care, but then also elevating risk and intervening when appropriate as well. So I think the kind of the remote patient monitoring on the biometrics as well as on the assessment side is a key component, and then leveraging a virtual care aspect to engaging individuals in a safe and convenient way is a key part of the strategy. And then I think around the again, getting into the different kind of the aging in place, I think the wellness models are really the emerging trend in the industry to the programs through the independent living and then accelerating the rest of the services across the continuum. So, going back to the value add of those type of services to the higher margin, but then also looking at really knowing your population first in independent living through the wellness models that really can help kind of grow the census. But then also I think it's creating a different type of brand and kind of consumer confidence in the agency when you're marketing against others in the industry, as well as individuals that are actually in the home-based setting.
So Fahad, thank you, AJ. Fahad, if you extend on where do you see on the second part of it, that data set really starting to pay dividends in the at-home population? Right.
Well, there's no disagreement on the more data, the better.
Yeah.
Right? And we have been receiving data from different systems and devices for some time. It's just that, there was never a focus on using that data for something meaningful. If you look at the EHRs in the past, especially coming from acute care, EHRs were designed more for reactive. Someone had an episode, someone had an accident, and the EHR is there to help support that whole experience. We saw that in skilled nursing also. But when you come into CCRCs and senior living, we see that changes and become more preventive. The whole care plans, assessments, they are designed to help make sure that people are being taken care of and we can prevent anything bad to happen. But with this data coming in, either in the senior living communities or in home health, now there's a unique opportunity to move from that preventive to actually predictive, to be able to figure out what can possibly happen to every individual. So that's one aspect. The other aspect is that, we were using using a big brush to paint everything. But now every individual is different. They have unique health challenges. Their background has been different. So treating everyone with the same type of services, same type of care may have worked, but may not work longer, especially if you're trying to bring people from their home into senior living communities. So a personalized care that is designed based on the data to provide a very personalized experience, personalized care to individual is going to be a game changer. And that's what's going to take the senior living communities to also look into the home health care, also to extend their services to people that are living at home, use their data, use their experiences, their technologies to serve them. So we are having those discussions. We are seeing there's a trend that the data can be used to provide that personalized experience, personalized care. And yeah, so we feel that that's where it's going to move.
Absolutely. And I think that is, we covered a little bit of this on Monday around the amount of data that's now being generated and available to really fuel these social determinant of health models where we can see broad strokes are not applicable. There has to be a customized care plan. Travis, any thoughts around the at-home and generally how much more data we've been able to collect through COVID that wasn't typical?
Yeah, I'd probably take it even maybe instead of building on the I'm going to take a step back, at least as we're speaking specifically to senior living.
Yeah.
And I'll give you an example. When the pandemic hit, obviously there were a lot of discussions and policy discussions and a lot of posturing and positioning in Washington, D.C. To get fair stimulus and really what the industry needed to make it through a very, very difficult time. On the skilled nursing side, we were able to come up alongside the associations and work in very close partnership with them to get really meaningful data in the hands of policymakers and people that were making these decisions. Because on the skilled nursing side, we have a lot of standardized data. From Point Click Care's perspective, we've got, around 11,000 SNFs where we could do a lot of stuff with Mark Parkinson and really represent the best interests of the industry. When it comes to senior living, and you started the question by talking about digitalization. In senior living, whether it's by design, and I'm not necessarily suggesting that we have to follow the same path as skilled. In fact, I think we would all see several examples of where that's not a desirable direction to go. But that being said, we do need to figure out a way as an industry to get some kind of standardized data in place out there so we can best represent the industry's interests in those scenarios and those situations. And when it comes to providing that transparency, it's not just about what's going on in our own worlds anymore. It's about these integrated care coordination networks and being able to make data visible and having dashboards and being able to benchmark and being able to drive that stuff. So you go back again to just the pure digitalization conversation and all the value. Senior living, I would put somewhere in that, I don't know. It's hard to gather because again, you have lack of standardized data, but when we look at the 5 stages of adoption, from digitalization, standardization, insights, interoperability, and machine learning, which Fahad was talking about, predictive, we can't do a lot of that predictability and machine learning until we have that digitalization that takes place up front. So as we're talking to senior living providers out there, just know that this is the path we're on. All the value added that Fahad and AJ discussed, it starts with that digitalization conversation, and we can't skip past that. Get the baseline in place, and then as technology partners, there's all kinds of things we can do. But we got to get to the point where the industry takes a big step forward from a digitalization perspective, first and foremost. Then the world's our oyster, so to speak. We've got all kinds of great things we can do with it.
Absolutely. Yeah, I think it's an exciting juncture we're at because it was a highly undigitized industry beyond the SNF and the very managed care settings. So I think we're seeing that spread across the whole spectrum, all the way back to even folks, I think now are paying more attention to data generating in the 50s.
Right.
Just to
Well, we
make
got
sure
into
they
that
can-
scenario, Nick, where the media and other forces outside were driving the narrative, and we had very little ability to come back and
Yep.
combat that, you know? So that's what the pandemic taught. That was a big lesson, one of them.
Excellent. We're going to switch topics or switch gears here around the topic of interoperability. And we've kind of had an a session outcome here. Will it help referrals and improve clinical outcomes? So I'm going to break the topic down a little further and just start with interoperability overall. So we know businesses see the definition of that word differently depending on where they need data to really combine and mesh with the data they currently have. Where do you see interoperability gaps overall in the LTPAC industry today? And if you think about it, it's really connecting the operational needs with the business needs. Why do you think they exist? And what do you think is going to happen over the next maybe 24 months to address the gap? So I'll start in reverse with Travis, you the last of the last question.
This is one I would have liked to have went last time, to be honest, but that's all right. We'll jump in.
Tough one.
But yeah, interoperability obviously is a big discussion, and I think, you know, maybe I would start at the beginning of it is why is it really important? And again, we've kind of been talking around these themes. I think, you know, all three organizations and see it in a very similar fashion, but you know, at its core, interoperability is about eliminating avoidable mistakes, eliminating negative outcomes because somebody didn't get a fax or a piece of paper, right? It's about getting things in place so that we can deliver on what ultimately is what we're all after, and that's to drive better quality outcomes in a more efficient and cost-effective way. And so at the beginning of its core, I think we get wrapped around the axle on the tech side, and we have to be interoperability. We have to, let's think about what we're really trying to drive and why it's important. And I think from a senior care, senior living perspective, I think it's about, you know, again, thinking about the value that we can add, benefits of being an active player in an integrated care coordination environment or world, the competitive edge that it can give us, being a better partner, again, driving those outcomes. So when we think about that kind of lays the foundation. But then, you know, the next question is, how do you actually share that info?
Yeah.
I mean, you know, how do you actually share it? How do you solve those transitions? How do you make that transparency real and deep enough? These are real questions. Again, from a senior living perspective, that conversation is secondary to making sure that the data exists in a digitalized format in the first place. Then you can get into a real interoperability discussion. On the SNF side, we're much further down that path. We've got a standardized tool like a MDS that we can do all kinds of stuff with. But, you know, so from an interoperability perspective, we've got new tools out there now like Care Quality, right? That's something that people can actively participate with. At the end of the day, Care Quality is only as good as the participants that are using it. Kaiser, very active on Care Quality. Not every health system is. But if they are, and we get more standardized participation in some of these, you know, scalable platforms that we can connect to and share with, that makes it easier. But I think at the end of the day, when you think about what really needs to be driven, whether it's reduced hospital readmissions, whether it's increased visibility that drive, you know, risk-adjusted scores for payers, HEDIS scores, all this different, there's a deeper layer that we need to be able to share and have visibility into that really drives the ultimate outcome. And I think in a call like today, I don't know how deep we want to get into that. I'll just plant those seeds. But from an interoperability perspective, I would just offer this, and I'll turn it over to Fahad or AJ. I don't, you know, when we think about the challenges we laid out early in the call, aging population, a really stretched workforce, and the inevitable prevalence of value-based care, none of that happens. We can't solve any of those challenges without meaningful interoperability, and really putting tools in the hands of people where this integrated care team, we can activate these teams, and we know which patients require intervention or attention right now. And we can step in and make a difference before their condition degrades. I went from A to Z in about 2.0 seconds there. But again, I think about why it's important. We can talk about all the things that need to happen in between, but at the end of the day, as a industry, as a market, we need to be able to provide data, put it in the right, at the fingertips of the right players, where we can activate these care teams and really intervene and have an impact on negative outcomes before they occur. That's why interoperability is important. And it's there. This is not Buck Rogers science here. We've got the ability to do these things. So I'll shut up and let Fahad and AJ go here.
Yeah, thanks, Travis. It's definitely not, it's been solved in many industries. I think acute care has investments in interoperability engines so they can really be very mobile or nimble in terms of what they want to connect. AJ, any thoughts on that topic overall? Where do you see the gaps? Why are they there? And how do you think they'll be addressed?
Yeah, I think that, you know, it's the kind of the debate around open and closed networks, you know, and I was just thinking about it. You know, the closed networks are becoming a thing of the past, where you would have, let's say, a health system that works with specific providers in their network, and that's the only type of data that they would send in there. I think now you're starting to see more open type network concepts, you know, and the thing is driving a lot of the downward pressures that we're seeing around value-based care, whatever flavor it is or whatever stage of value-based care that you're in, you're really ultimately trying to remove cost and remove risk from the equation. And the only way you do that, specifically from the senior living side, is the transparency of data and having data at the right time. So that, you know, providers can be able to take in a referral and have the relevant clinical information they need in order to accept the referral and start an admission before the even person shows up. Because too often in the past, and I think this goes to Travis's kind of digitization thought, is around the person would show up without any of the clinical information from the hospital. So if we're trying to reduce the risk, we need to make sure that that information is flowing seamlessly, and then it's also into, you know, a workflow inside of the application that is really driving that level of efficiency and really taking away not only the risk of a rehospitalization, but then we also think about, you know, providers and staff making their jobs more efficiently, which is also I think we're going to talk about a little bit around physician efficiency and satisfaction, but, you know, even looking at that as a cost driver as well. So I think that, you know, the continued drive for more of these open networks, talked about it with Care Equality, Commonwealth Alliance, eHealth Exchange, some of these national frameworks where we continue to see growth and adoption is going to be important. But then also how we enable our side of healthcare to connect directly and integrate directly into acute and ambulatory providers as well. And I think that even flows all the way up to the into the payer plans as well. Because while it's really important to be able to share from providers, it's also really important when we're looking at more on a population level of how to best manage my individuals, is to get a broader data set that can then drive into some of the tools that are popping up in the industry around machine learning and AI. But kind of coming all the way full circle back, I think that some of the challenges that we need to continue to drive is to make sure that these networks are open from the health systems and accessible, and that the technology is aligning to the clinical workflows that's also aligning to the business objectives. And I think if I kind of put a bow on it, I know Travis and Fahad and I can sit here and talk for days on interop, but kind of putting it into a kind of a concise way of thinking about how do we really promote open networks and open interoperability that can be the foundation for senior living operators to do a lot more with data in order to drive that level of efficiency and outcomes that healthcare is now demanding of us.
Thank you. Fahad, anything to add? And then we'll quickly go to the next question.
Yeah, just briefly, you know, as AJ mentioned, you know, the business outcomes, you know, we've been talking and hearing about interoperability in our space for years now. But when it comes down to actually using it for something meaningful, some outcomes, ROI, better care for residents, that's where we were always run short. So now there's an opportunity to say, with all this data coming in, yes, it's going to make an impact in your workflows, in your day-to-day operations. It can in the care and so on. If that's proven and that can be through ROI proved, then this becomes a strong case, and you'll have customers asking for it and probably wanting to invest in it also with us. One thing I just want to touch on, and that's something Travis was talking about earlier about the standardization of data in senior living. This is a huge problem. We have, as Travis mentioned, this has been solved in skilled nursing with some standardization. I just want to say that, on this call, on this panel today, we are some of the leading EHRs in the space. There's also responsibility that lies on us to help lead that initiative. We are very handful in this space. They're not like hundreds of EHRs.
Right.
We're very few. So there could be an initiative from us also to facilitate that process of standardizing the data. So it's as important as Travis said, and I completely agree with it, but I think there's also a responsibility on us as much as it is on anyone else.
Yeah, it's definitely been brought to the surface. So the second topic on this agenda, and I'll point it back to you, Farhad, is we see a lot of silos in data. So when we have silos and we sit all across different data sets, there's huge value sitting in a data set and it's sitting in the SNF, or it's on the hospital you're partnered with, yet the silo doesn't get broken. If you take that silo question and you look at the role of the HIE, we're now starting to see kind of more mature HIE discussions happening. They're now embedded in some of the platforms we use. What do you think do you think the HIE solves the problem, or what's the role of the HIE? Because obviously the big care settings that the LTPAC really interacts with is acute care, and HIEs seem to be the bridge. So I'll hand over to Farhad. What's your thoughts around that?
Yeah, I think the bigger question before we talk about HIE is that, who will collect the data and who will analyze it? Is this the responsibility upon the EHRs to collect the data from financial systems, from CRMs and other places, and provide a 360 overview to operators? Or does this responsibility lies on the operator to set up their own data teams, set up their own data warehouses, their own reporting? And I don't know if there's an answer to that, but it feels more like that, if operator wants this 360 view, which will be very different for each operator, right? And they have different systems that they have data in. It feels to me more that, it's upon them to figure out their data strategy where they're going to collect all the data from these silos, right? And connect with HIE and other systems, and then create the views and reports and analytics that they need to run their businesses. So that's my 2 cents on this HIE integration.
Makes sense. Yeah, that's one data set. AJ, any thoughts around that? But I do echo what Farhad said. There is less of a notion of a data warehousing reporting strategy owned by operators. It's really is a need, and I see it's not as prevalent as you see in other industries. But AJ, any thoughts around?
Yeah, no, I think that, health information exchanges, I think the noun is part of can help solve some of this challenge. But, just I think of HIE as the verb, right? It's the movement of data. And to Fahad's point, it's looking at the provenance on where that data is captured and how do you make it accessible in the right point of view is really the key. And I think that, we're continuing to see the move around health information exchange through these more open data sharing collaboratives. Talking about care equality as a national framework, talking about Commonwealth Alliance, Health Exchange, I think are kind of giving kind of a fabric to enable more broader scaled interoperability where senior living and care at home and social services and behavioral health are all participating on that framework. And it really moves into what I think I was saying is getting into more of a federated type model, right? So depending on the piece of information that I'm looking for, I have a mechanism to be able to find out, to go, where can I find it and how do I go pull it into my system? When you think about it as a very simple way of thinking about interoperability, is to identify where persons have been seen, who has data on them, and then how do I pull it? And then how do I make it meaningful into my system? And I think that, you know, looking at some of these common frameworks creates a trusted environment that's really going to scale, that is not necessarily limited to a geographic boundary, because we know that individuals seek care outside of a county, outside of a state or a region. And it really allows us to moving from not just document exchange, but also to start to layer on additional services on top of these frameworks, whether we're talking about, you know, enhanced care coordination. So I want to receive notifications on my population if they are being treated inside of a hospital or they're getting primary care services. But then also looking at how do I leverage these frameworks to better manage the referral process. So I think that to kind of to wrap it up a little bit, looking at, you know, the HIEs themselves, I don't think are the solution entirely. I think more of these kind of open sharing and networks and frameworks that are kind of taking the work that's been done from you know, an EMR company, and, you know, from even on the acute care side, where they're really good about sharing data amongst themselves, but then now having inroads in so that it opens up their system so that now it could share more broadly across the kind of the full community base in care continuum providers.
So definitely we agree, and I'm sure Travis agrees that the medical data is a big topic. But Travis, if you add anything to that and talk about what's your view of the operator's data, as Fahad had mentioned, because there's a lot more data that's not in custody of acute care or post-acute care that's really embedded in operations.
Yeah, well, I think, you know, AJ did a nice job. The geographic limitations specifically to address the HIE. I mean, there are some geographies where HIEs are really strong and they have a lot of participants. There's others where they haven't had that same level of success or gotten that same level of traction. So I think AJ put his you know, finger right on the challenge with HIE and the limitations that could have. When we look at the next, you know, whether it's Care Quality Commonwealth or some of these national frameworks, you know, then we get into some gaps there too. Again, care quality is going to be as good as the participants that are all on there. And again, that's going to probably depend a bit upon the health system that you're trying to. I think the main message here that we're probably trying to send, to cut to the chase, Nick, is you need to do your homework. And even if you're a national chain, it's probably not a one-size-fits-all solution. You got to kind of know where you're at in those regional healthcare ecosystems, know what the main, what the best paths are to really getting established and being able to share data, even down to the health system level. We know we've got a great relationship with TriHealth. We know when all the right dynamics are in place. We've already been able to prove out that we can absolutely drive down readmissions, for instance. So it really depends upon getting beyond just that CCD sitting on the chest of a patient as they're transitioning, you know, on a gurney going from one place to another. But I think if we take a look further at those gaps, again, with care quality, with Commonwealth, ask, you know, is it a pull model or is it a push model? In other words, are we pushing and pulling data? If all you can do is log in and pull the data, how are you going to get alerts proactively? How are things going to be identified where we can actually send notification that it's time for the right people to intervene before a condition degrades? Those are real, at the end of the day, I think where some of these things came up short, and Fahad touched on it earlier. People get excited about the conversation. Yeah, we need to connect. We need to connect. But the reality is, whether we like it or not, transparency is a new currency. It's a new currency to really be able to get at the seat of the table, and good partners are going to foster that transparency. You know, we're going to have to figure out ways to get around the limitations of just a pull model. You need to have both. I think, again, we're going to need options. It's not going to be a one size fits all. And we got to get deeper on the level of insights for it really to provide value. And it's not just a checked box that says, oh yeah, we're participating. We can do a CCD. You got to get to that next level deeper in conversation with practitioners, with value-based care organizations, and really look at ways that you can bring value to what they're trying to do. We're all in this together to improve quality. We're all in this together to do it more efficiently. But what data really needs to be shared to have an impact on those desired outcomes? And that circles back to whether it's an HIE, whether it's care quality, whether it's Commonwealth. If that's the actual business outcome we need or care outcome we need, how do we provide the right environment where we can really, truly make that happen? And some of the challenges is HIEs didn't check all those boxes. Some of the challenges, even with care quality and Commonwealth, there are still gaps in there. Get in there. You should expect your vendor to have solid answers to those questions as you start talking about how you can have a meaningful impact and really drive value into these conversations and the ecosystems you're operating in.
Thank you. No, I think,
Nick, just to close on that, if you look at adjacent or other industries, this is a problem not unique to us, that we have data in different silo systems. Even other industries have similar problems. And there are third parties, consulting firms that come in, like your organization, Nick, that would come in and solve this problem, whether we're talking about Accenture or MuleSoft and all these bigger organizations. All they do is that they help collect the data from silo systems and create meaningful reporting analytics for businesses real time to run their operation. So we're our customer, and we are not unique into this problem.
yeah, no, absolutely. So, we've got, we're going to go deeper on that. I'm going to do a time check, so I might reverse some of these questions and ask for more summaries, because I want to leave some time for the audience. Last question, which is really what we wanted to address in terms of interoperability, how we help with referrals. What I see in industry is there's a little still choppiness between how do you receive the right referrals that correspond to your skill set as an organization, and how do you filter out so that the best outcomes can be derived, and how is technology aiding that specifically? So maybe I'll start with AJ.
Sure. So I think the kind of use of data can really help drive senior living operators to target in the market the referral sources to create the highest value of services for their agency. So for an example, I think, looking at from a platform perspective, to be able to take referral data from the kind of the health systems and in ambulatory practices in a geographic area to really determine the types and quality of the referrals that are sent out, and then being able to use that data to really set targets and goals from a business development perspective to engage with the outcomes of the senior living communities in hand to really help go and drive those referrals and that stronger, deeper partnership with the health systems. And also the systems that take data and really looking at running machine learning algorithms to determine kind of the risk to hospitalization or of a new referral that's coming in at the time of referral, and then also taking that data to look at the predictive kind of level of services that a person or service makeup that a person will need. So, thinking about how, these types of tools can help remove as much risk from the equation as possible to really help drive up those outcomes back to the hospital to really kind of further solidify the positioning inside of your network. So I think, getting into the actual, doing the referrals and the marketing and really understanding patterns, and then being able to take that data and put some intelligence on it so that I can look at my high risk, but then also look at, what type of services do I need to deliver based on an individual's needs, and then taking that outcome data and then marketing back up. I think that's a way to how to leverage kind of technology and data in different unique ways as it relates to the referral management process.
Travis, from your perspective, does that align with the view from Point Click Care?
Yeah, I think AJ answered that really well. The only thing I would just add, I guess, and this is more from, again, if we're talking specifically about senior living, we, at least in our customer base, we see a very wide array of people that are comfortable going out and calling on different referral sources, whether they be more needs-based referral sources, or the way that, whether, you know, the traditional, again, you know, hospitality type referrals that they've driven. I mean, you just, I think depending upon who's on the call and what job they have in senior living, just a reality check on where we're at today versus where the potential of tomorrow lies, in really taking an audit of what transitions need to happen within their operation to thrive in that new normal. The technology is there today. You've got tech partners out there that are willing and able to facilitate this journey alongside you. But to just expect somebody that's never called on a health system or a health payer and to you know, get them to the point where they're acclimated and comfortable showing up with these outcomes-based reports and data. I mean, this is just, there's the real world examples of what this transformation looks like. And I think, at least in our experience, most senior living operators are at a different point in that journey. Again, I think it's fair to expect a lot out of your tech partner in this space, because they should be prepared and ready to equip you with the right data to go and have very meaningful dialogue with these folks. It can have a huge impact on your operation, and it certainly can have an impact on your occupancy. But I think the tech is there from a senior living perspective. We just need to make sure it's the right tech for where they're at in that journey.
Makes sense. Yeah, the tech's been available. I think it's organizing it and pointing it very specifically to what you're trying to solve. Fahad, anything to add?
Yeah, just agree with Travis. Just I'll add one point to it, especially with focus on senior living communities. You know, the sooner they can be part of that decision-making journey for residents, for prospects, the better it is for them. So if someone has shown any interest in moving to a senior living community, it's the best interest of the communities to engage with them, to bring them to the communities, show them what is there, and be participant to their process of making, to the point where they make the decision and they transition into the senior living community. And you know, historically, it's been very difficult to do that with paper, with phone calls, with salespeople, marketing people calling them up. But as Travis mentioned, you know, there are technologies, and the technology will improve over time that will help make that very easy for communities to engage with, not just like 10, 20, 30, but hundreds of prospective customers. So we see there will be a shift, especially when after COVID, when they're trying to increase the census, communities will creatively think about how they can engage with the residents much earlier, with the prospects much earlier in their journey.
Yeah, and I know we've talked about groups that are looking at the data, they're standing on the sidelines. We've been looking at the quality of referral partners and then guiding the right data and the right referrals back. I think there's a kind of a movement around value-based care that's going to sit on top of this, where referrals really get pointed to the right person for the best outcome. So I think it is definitely moving in that direction. I'm going to move on to our last topic here, strengthening the continuum of care with software and technology, leading vendors' approach to breaking down the post-acute care silos. We've got a lot to cover here. I'm going to kind of maybe summarize in reverse one of the topics that we'd talked through. End user adoption. So that's obviously we've got a very good workforce. There's workforce challenges. These are not tech savvy workforce for sure. Their goal is to provide the best care they can. Often user adoption's an issue. Embedded in that, we see automated workflows, machine learning coming to the surface. Now there's more data. We're seeing that the platforms themselves can make the jobs easier. And then the last topic, we've touched on it here, is operators are overwhelmed. There's a lot of data available to them. There isn't a clean way to say this is exactly what you need to pull out, what you need to do, and here's how you organize it, and here's how you put it together. Even if you take interoperability out of the equation, there's already a lot of data to deal with. So maybe I'll start with Fahad.
Yes.
How far along do you think we really are on the machine learning journey? It was really not a real story in 2-3 years ago. There wasn't enough data. I'm seeing now real energy being spent on it. My group's working with something with academics on that front. We've done a lot of work, and there is real outcomes we can see. But
Right.
how far do you see as a provider of technology that we are in that journey?
Right. Well, the thing about AI is that it may not have a solution that's very visible, that's the shiny, that's the glamorous, that glitters. All of us, all the EHR players, they have some initiatives going on and have done some projects on machine learning and AI. And that's adding value to the user, but may not be visible. I'll give you a few examples in our case, with the EMR, with medications, we have put in machine learning where we can detect conflicts in the medications so that we can proactively tell the nurses that, we don't think this is the right medication, you need to consult. We have put a machine learning algorithm, a component that tells us that if the medication is coming in from the pharmacies and that medication has changed abruptly, we will create those red flags and share with the pharmacies and others.
Right.
So many different components of AI that we have put in. Now, some of them are more visible, like false risk score, where you can actually see a score based on the data and users can appreciate it. But there's a lot of other stuff that's behind the scene that's just helping us as much as it's helping customers improve the quality and improve the adoption. So one other example is that, when adoption is on top of mind for all of us. It's not just a problem with the communities and their staff. We as an EHR and wellness and other platforms, we care a lot about adoption, right? So in our systems, we continue to add features that automate things, automate workflows smartly without having user to go in and click 10 times to do that, right? So I believe that, yes, there's going to be a big glamorous outcome of AI that everyone can see, but there are a lot of things that are happening behind the scene that's powered by machine learning.
So I'm seeing, and Travis, what's the perspective from Point Click here? Are we quite far along the journey, or are you seeing there's a lot of new and exciting things to come in that space?
I would put us more in the new and exciting things to come category. A few years back, we were fortunate enough to recruit some really talented individuals as far as advanced data scientists, and we're doing all kinds of cool stuff there, especially on the skilled side where we have mountains of data and consistent data, where we can do false predictions and we can predict hospital readmissions. And I mean, we've got building the algorithms and doing the models and doing the work. Again, it's kind of like interoperability. To do it probably isn't going to get you very far. To do it to solve real world problems and challenges, it's going to be really meaningful. So I think that if the question, Nick, is where are we on that life cycle? I think it's still early days, but I think that, like Fahad and AJ, I'm assuming that most of the tech companies absolutely are building out those capabilities within their organizations, and the future is very bright. I think there's a lot of value that we're going to be able to deliver.
Agreed. And AJ, how's that journey for NetSmart?
Yeah, no, a similar sentiment on kind of where we are on the maturity level, I think, as an industry using AI and machine learning. I think that it's, having the technology tools and the data aggregation tools are really important, and access to a broad data set. And similarly, we have worked to create kind of looking at referrals and risks out of rehospitalization, even prescribing, service level needs. But other area, and then ultimately driving what Fahad's talking about around clinical decision support, right? So I can take assessment information, medication information, diagnosis information, and be able to predict the right path that from a treatment perspective. One example that I was thinking of around this is thinking of it more broadly at a higher level around care coordination and looking at how to take in data, whether it's direct kind of EHR documented data from outside sources, patient reported data that is used in order to create or automatically create tasks, then automatically create care plan actions, and then assigning direct interventions. So kind of taking that data, putting intelligence and knowledge on it that's really driving a level of care and care planning to specific interventions and tasks that individuals need to do that are at the highest value, that produce the highest outcomes. So you're kind of getting that directed learning, creating that knowledge flow loop. And then ultimately, when you're looking at it from a care coordination or a pop health perspective, it allows you to create and identify cohorts based on individual needs and risks, and then assign the appropriate tasks and interventions in order to drive the highest level of outcomes, and doing it all kind of within a reporting period, right? So I'm not retrospectively looking at how I did, but now how prospectively am I doing, and being able to adjust course. So I think we're seeing some different flavors of it. People might think AI, machine learning is one thing, but I think when you're looking at how do I, predict and drive the appropriate level of care or service care delivery in order to achieve those optimum outcomes, and doing it in a way that allows for actions to be taken proactively rather than reactionary, is kind of the direction where we need to keep moving.
Absolutely. So I'm going to, we covered a lot of good topics. I'm not going to go through the rest of the questions. I think what I'll do is summarize on the role we think, how do we strengthen the continuum of care using software and tech? As you heard from the panelists, we're at the inception of a very exciting journey around data, really allowing us to, create these machine learning AI type care settings through technology that, reduces the burden on the staff and also has a lot of science behind it. We did see, and I'll cover the two topics that we were planning to go through, but I want to leave some time for the audience. Adoption, I think 2020, as we talked through this earlier, we think there was a slight pause, but that did give time for these partners that we see on our panel today to look and see what the real needs of the industry are. And there may have been some calibration we discussed today. And I really think that we haven't really addressed value-based care. The industry's been tasked with it, and we're starting to see that creeping in and more of it, where the mindsets are changing. But what I'll summarize is, with what I take notes as a discussion, is there's an enormous opportunity to digitize. We are digitizing. As we digitize, we need to organize the data and make sure it's in a state that's very actionable. And then I would call it really monetize or create value from that data is what we're steering towards. And I'll stop there for Q&A, and I know Tom's going to help us with some of the audience questions. But I thank the panelists today, and then we're going to move to audience questions.
Hi, Nick. Hi, gents. If we start off with a question from Jack Cummings, and this is to all panelists. How do you see your EHR solutions interacting with Epic and Cerner?
Should we start with Travis?
Yeah, let's start with Travis.
Appreciate that. You guys always give me the first go at these questions. That I think that I think AJ and Fada both touched on this. We're seeing a movement toward more open access to different solutions and the breaking down of silos. I think we're seeing more and more initiatives. I think probably people that have been watching, we did a major acquisition of a company called Collective Medical. Collective Medical already captures data from over 1,300 different health systems across the country. So we're certainly communicating with Epic and Cerner. That's happening today, and I think those silos are continuing to break down.
Fahad, anything to add on Epic and Cerner today with the EHR?
Yeah, since we're more focused on senior living and CCRCs, we don't have much use cases for that integration. So I know not much experience.
And AJ?
So we've been working with Cerner and Epic for over 10 years, and really was around some of the other use cases that support even on the behavioral health and social service aspects. Because I think their customer base is acutely aware of the need to be able to communicate and share data with the community providers. And we have built direct integration into their network so that we don't have access to just one Epic or Cerner hospital, but access to a number. But as Travis mentioned, there's different use cases to connect in. If I'm going in and I'm pulling data from their systems and incorporating it in, or if they're pulling directly from a NetSmart client and consuming it in. But then there's also advanced, whether we're connecting in to do lab and radiology, or we're doing medications, or they're accessing some of our social determinants of health data and incorporating it into their healthy intent or healthy planet population health solution. So the key here is to integrate at the network level, and then you work on the specific use cases of the data that you're flowing so that there's value on both sides of the equation. For others that are thinking about kind of stepping in, we talked about some of the national frameworks that are available, but we have, as well as Epic and Cerner, kind of an open API, Fire-based API network that really is tailored towards a streamlined approach of how do I plug in based on the specific use case or data sharing scenario that I'm looking to solve for. So I think in that same breath of the open concept, seeing more openness across healthcare, not just with Epic and Cerner, but with other HIT vendors as well.
Thank you. Tom?
Perfect. I think if this was relating to something that Fahad was speaking about, and it was measuring the ROI of data in your day-to-day operations and improvements, how do you actually measure that at the moment?
If this is a question about measuring ROI for our organization or for our customers?
For both, I think.
Okay. For our organization, what we have to, we survey customers from time to time. We look at the data of usage and adoption. We look at the industry trends and make sure that, we build solutions that not only provides ROI to us, but also to our customers. So it's meaningful. So that's a ongoing process to improving the product, improving the platform, building new features. For customers, again, there's so much variation between, even in the senior living communities, from IL to AL to MC. I don't think there is a well-defined ROI that's applicable to all. So it really depends on organization to organization. I think now after COVID, well, not after COVID, but as things are getting better, they are starting to figure out, what works for them. What is important to them, how can they bring back that profitability that they lost in last 12 months. So we're going to see that shift. We're going to see that changes in their measurement of ROI. So it's still pretty fluid.
Yeah, and just Tom, just to add to that, from my seat perspective, I think operators have really stepped up and they've embraced technology. Outside the technology, the industry is really heavy on the need for labor and HR and the workforce in general. So I see really forward-looking operators embrace how technology is going to be woven in and used across the workforce. And then in turn, if you look at it from a P&L view, that helps improve the baseline P&L they have, meaning with minimal use of technology, with extensive use of technology, there should be a shift in terms of how labor hours are used. That's something that's quite a large component of the cost.
Perfect. Thank you, Nick. AJ, I think if I try and aim a question at everybody, that would be great. The question is, how do you navigate data protection laws with so many different sources of data, especially as it's not clear who's responsible for collating and presenting that data?
Good question. From an overall security perspective, there are the kind of the industry technology standards that are layered on, whether it's from a formal process around the Office of National Coordinator and their kind of meaningful use interoperability data standards, or what we're seeing from the info blocking rule. And so there's a baseline kind of technology standard from a security perspective of how to transport data. A component of that, though, is really important. It's the provenance. So being able to flag where that data came from, kind of the source of that system, and maintaining that integrity when we're sharing it around and that data is being built upon. And then there's also consent, patient consent. So looking at it based on the kind of the levels of consent, and consent is almost the interpretation of the provider, but the consent is really on the organization that is sending data out. So you may have a consent process where you say, I'm going to get an admission, I'm getting a HIPAA consent, and for the data to be shared by my provider to any other provider that has a treating relationship. And then the kind of the technology tools help understand who has the treating relationship with not, and being able to send out that data. But there's also kind of granular consent, and I'm kind of getting a little bit in the weeds, but I'll stop at this level. But you have to be able, the system needs to be able to capture granular consent. So the patient may say, I only want this set of data to be shared with this set of providers. And the systems need to be flexible enough to make sure that they're only sending the consented information that has been provided, and then being able to track and monitor and log all of those types of disclosures. So if your question is along the kind of the technology security side, a lot of that is covered from an industry standard perspective. Even on, we talked about some of those frameworks around care equality and Commonwealth. There's a governance structure and a BAA structure. So you have kind of the governance side of interoperability, and then all the way to the patient person level that can help dictate and direct their healthcare data and how it and when it is shared across the broader healthcare ecosystem.
Thank you very much, AJ. I think that is roughly all we've got time for. I'd say any final comments from any of the panelists. I guess if we start with Nick.
Yeah, just to add to AJ's commentary around data protection laws, obviously that's a very solid framework, but we're also seeing the need for extra vigilance around cybersecurity. Yes. I think our industry got digitized dramatically from 2019 going into 2020 with a lot of digital data moving around. It's imperative that audience and panel really don't discount data security and how you protect it. That's all I wanted to add, but it's a related topic.
Good point.
Perfect. Fahad, any final words? Yeah, well, thank you so much for having me on this. Just briefly, this industry is seeing a shift, a change. There's more recognition for data and how it can be used. And I think the EHR companies are also catching up and trying to support this industry with the change that's coming in. So we're all very excited about what's coming. We've all been talking about it for such a long time, and it's good to see that turnaround and that evolution.
Perfect. Thank you, Fahad. And we'll start with AJ and then Travis for any final comments.
No, just want to thank for one the attendees, but in the panelists. I appreciate the dialogue with my colleagues here in the industry, and I think there's been a strong rate of change that has occurred in our side of healthcare and our technology tools. It's important that we are not only keeping up, but we're staying ahead of the curve and helping shape the curve. I think that's the kind of the call to action, is that continue to be advocates in our communities, continue to drive interoperability and care coordination initiatives, and make sure that we're helping shape the future in order to account for our side of care and ultimately having the best interests of the person in mind.
Perfect. Thank you, AJ. And Travis, last but not least.
Fahad and AJ did a nice job summarizing. Maybe I'll just take the 10 seconds to answer the one question that somebody asked directly to me that I didn't get a chance to answer. The baseline for digitization, pretty straightforward. Weights, vitals, diagnosis, change in condition. should be doing your service assessments and service plans, and then have a point of care device that's capturing real-time information. So I did that quickly. Whoever asked that question, reach out to whoever you want. Happy to get you more information, but I saw that question come through and wanted to get it answered. Thanks, Fahad. Thanks, AJ. Thanks, Nick. Appreciate everybody.
No worries. Thank you. Thank you very much, all panelists and all speakers, and thank you for the questions. This concludes our final session of the Senior Living Transformation Summit. It'd be great if any of the attendees or panelists would like to share some short feedback from the summit. You can actually find the feedback tab on the main website on the event platform. We'd really appreciate it. It's just 2 minutes of your time, and I think it's about 5 different questions. If anybody's missed any of the sessions, they will be available on demand for the next kind of 2 months on this platform. But I just wanted to say once again, thank you to all of our speakers and all of our attendees, and we do hope you've enjoyed the summit and have a very happy Easter as well. Thank you very much, and we will see you in 2022.
Great, thank you.
Thank you very much.